right around August or September or so through the end of the year, it just seems like things get busy. The summer's kind of wrapping up and things are starting, and it just seems like time goes fast, and before you know it, it's gone. And then you're like, oh, I didn't take action. What do I do? Let me break it down for you. What am I talking about? Enrollment into Medicare. Now, is this fun? No. Is it exciting? No. Is it boring? Oh, it's boring as all heck, right? We all recognize that. Don't get me wrong. I'm not sitting here acting like, oh, Medicare enrollment is so fun. No, it's not. It's not fun. Nobody wants to do this. It's not fun at all, but it's something that you need to do. Otherwise, you could be looking at a nasty situation. And remember, here's the deal with it as well. If you're turning 65 or retiring, don't get me wrong, Medicare is awesome. Medicare is really, really good for a lot of people, but if you don't do it properly, if you get the wrong supplement plan or Medicare Advantage plan, or you don't enroll in time, it could be a nasty financial nightmare for you. And again, I dealt with that a number of years ago when Medicare was provided to me as an SSDI, Social Security Disability Insurance beneficiary. After a couple years of getting SSDI, I had the opportunity to enroll in Medicare. I didn't, because I was like in my kind of late-ish 20s, and I was like, I'm healthy, I work out all the time, I'm good, I don't need health insurance. I didn't know, and I enrolled like 5 or 6 years later and got a huge penalty as a result. I can talk about that more later if you want me to, but let's talk about the details on this. All right, here's the deal. If you're turning 65 or retiring in any of these months that I just mentioned, or if you recently turned 65 or retired over the last couple months or so, dude, you've got to act like right now. Seriously. Again, I'm not trying to sit here and be like, act now because you're going to get a huge penalty. But at the same time, I kind of am saying that because you really do need to take advantage of this time that you have. Anyway, the initial enrollment window is a 7-month window. So for those of you that are turning 65 in November, your initial enrollment just opened up for you. If you're turning 65 in, say, October, your initial enrollment opened up a month ago. If you're turning 65 in September, your initial enrollment opened up a couple months ago. And if you're turning 65 in August, you've got to act right freaking now. Because my point being is that your Medicare will not start immediately. It'll start at the beginning of September. If you turn 65 in August, you've got to do this like right away. My point being is that you have this initial enrollment, okay? Your initial enrollment window, it's a 7-month window. The 3 months before, the month in which you turn 65, the month of your 65th birthday, and the 3 months after your 65th birthday. Okay? So it's a 7-month window. But to be fair, you probably want your Medicare to go into effect immediately, or at least as soon as possible, okay? And again, let me point out super fast, and I'm just going to spend like a minute on this. If you miss your initial enrollment and you forego enrolling in Medicare, there's a 10% lifelong penalty for every 12 months that you forego enrolling in Medicare. This is what I did, okay? Quite a few years ago. I did not enroll in Medicare for like 5 or 6 years after it was offered to me because I didn't think I needed it. I didn't enroll. I got hit with a huge, like 40-50% penalty for however long that I waited. I don't even know how long it was. It was either like 5 or 6 years. Anyway, I got like a 50% penalty because I waited, call it 5 years, 10% per year for 5 years. It's nasty, okay? That's a lifelong penalty, and I want you to avoid this. Now, a couple things you need to understand is, number one, you might be thinking, I don't even know where to start to enroll in Medicare, okay? Here's what I got for you. On the screen here, free Medicare help. Take advantage of this. You don't have to. I want to make it very clear. You do not need to call them. But this is for Chapter Medicare. They've helped multiple thousands of you in this community collectively save about $3 million in the last year and a half. You can take advantage of that, but you don't have to, okay? I want to make that very, very clear. They will do all the grunt work for you. They will do everything for you, okay? Start to finish, they're going to ask you some questions. It's free. You will connect with a real, trusted advisor. So if you want to avoid all the confusion, the frustration, the headaches, the overwhelm, and all the questions that you're going to be having when you enroll in Medicare, literally just contact them, free, right there. You'll connect with a trusted advisor. They will answer your questions. They'll look through the 20,000+ plans that they have access to find you the best plan for your personal situation that can help you with your initial enrollment and make sure that you are properly covered. Take advantage of that. Otherwise, you're going to have a ton of questions. You're going to be confused. You're going to be overwhelmed. It's probably going to take you days, if not weeks, to get it done on your own. Literally, if you call them, Chapter Medicare, they'll have it done in a matter of minutes for you. I mean, it could take 20, 25, 30 minutes, or it could take shorter. It could take longer, depending on your situation and how many questions and things you have, but they will guide you for free. Take advantage of that, okay? Stop trying to hack this out yourself. All right, so anyway, point being is this. Remember as well, Medicare will start the first of the month. Now, let me give you a couple examples. Let's just say that your birthday, as in you're turning 65 in November of this year. Okay, first off, happy birthday, that's awesome. Now, if you were to enroll right here, right now in August, as I film this video, would your Medicare start right away? No. Would it start as of September 1st? No. It would start the first day of November. It would start the first day of the month in which you turn 65, okay? That's what you need to know. Now, let me give you another example. Let's just say that you're turning 65 right now in August. Okay, you're going to enroll in Medicare because you haven't done it yet, and you're turning 65 in just a matter of days. Happy birthday. That's very exciting. Now, if you enroll right here, right now, today, does that mean your Medicare starts immediately? No, again, it does not. Why? Medicare is always dated to the first of the month. Therefore, your Medicare would start September 1st if you're turning 65 right now in August. Okay, that's what I want to point out, because a lot of people think, I enrolled in Medicare. That's awesome. It starts right now today, right? No, it doesn't. It starts the first day of the month. Medicare is always dated to the first day of the month. Now, another example. Let's just say that you're turning 65 in September. You enroll right now in August, because you can. You're still within your initial enrollment, okay? Your birthday's coming up in September. You're turning 65. You enroll in August. When does your Medicare start? Starts September 1st, because that's the first day of the month in which you turn 65. Now, let's just say, example, again, you're turning 65 in September, but you don't enroll now. You don't enroll in September. You don't even enroll in October. And then you think, uh-oh, I turned 65 and I don't have healthcare insurance. What do I do? So you enroll in Medicare, let's just say in October. When does it start? It would start the first day of the following month, which would be November. So you, in that situation, in this example I just gave right here, this person could go a full 2 months. If they turned 65 in September and didn't enroll, they could go September, October, until their benefit or their Medicare would actually start as of November 1st in that example. Okay, that's why it's so important, because if you don't act on this and you wait until the month in which you turn 65, your Medicare wouldn't go into effect until the first day of the following month, which could leave you with a lot of risk. In other words, you may not have healthcare insurance or coverage for a full month. That could be really bad. That could be really, really bad financially, because anything that comes up is going to cost a lot of money. Which, by the way, have you seen how much it costs to go to the doctor these days? It's a lot of money to just go to a simple doctor to have, like, hey, I got a cough. It's like, oh, that'll be $350. Like, what?